So this really is the day to think about some of the worst things, and HIV is definitely one of them. So the human immunodeficiency virus causes the disease, the acquired immunodeficiency syndrome, and this became well known in the 1980s. And what we notice is people lose their adaptive immune systems. And it's a very tricky thing because the virus doesn't cause really specific symptoms for the majority of the time a person is infected, and the person will gradually lose their adaptive immune system over a period of years. So before they notice a major thing wrong, they have no idea that they have viremia and can spread this virus very easily through sexual contact or through blood. So it's a disease every clinician should know about because it is lots of people have it. It's a global pandemic which has never stopped. So the disease has been spreading around the world now for almost 40 years, and there have been tens of millions of deaths. There still are tens of millions of people who are managing infections, and that won't change anytime soon. So we're still seeing, there are places in the world that have a very high burden of HIV infections, and lots of people get infected every year. It's less likely to get infected in the US, partly because we have effective treatments for it, and people who have access to these effective treatments are less likely to pass it on. So that's some good luck for us, good news. So that's some good news on this front. So as viruses go, HIV is one of the most amazing, I would say one of the most amazing, worthy adversaries virologists have ever seen. Not unlike Ebola, it has a very wide tissue tropism. It can infect lots of different cells, and we are always discovering new behaviors of this virus. Partly because it mutates so quickly, it can gain new behaviors. And so things that might be true now about the virus might not have been true 5 years ago, or even yesterday. So it is kind of amazing in how fast it can mutate. It's also the first famous retrovirus. So this is the first retrovirus most people ever heard of outside of the virology community. That means it replicates through a reverse transcriptase. And what that means is it has an RNA genome, and when it gets into a host cell, it makes a DNA copy of its RNA genome, and then it makes the complementary DNA strand so that it has a double-stranded DNA copy of this that can then incorporate itself into our own genome. So someone who has an HIV infection has copies of the HIV genome in the genome of every cell that's infected. So the reverse transcriptase enzyme is a bizarre thing, and this is an example of a situation where a biologist years ago thought, I wonder if there are any enzymes that can make DNA from an RNA template. And that person had no reason to ask that question outside of curiosity. But that led to people discovering the retroviruses. That led to the ability to treat HIV. The thing is, medical research can't just start and know what to look for. When a new disease comes up and no one knows what's causing it, we can only look where we know to look. We can only look for causes that we know exist. And until those nerds got curious and discovered the retroviruses, no one knew they existed. And so if if they hadn't already discovered the retroviruses just out of their own curiosity, there would have been no way to discover HIV, and AIDS would still be a mystery. That's a thing about research, is it can't start in the middle of nothing. You can't go out and answer a question like what is causing this disease without already knowing what the possible causes could be. Okay, so what happens when a person gets HIV is it will initially lead to a high viral load in the blood. So they'll have viremia, and they'll have a strong immune response against it. So they'll have antibodies against it, they'll have cell-mediated immunity against it, but it will continue to replicate. And then they'll go into a clinical latency for many years. During that time, they are able to spread it to other people, and at the end of that, they go into acquired immune deficiency. So one thing HIV does is replicate in and kill the CD4 positive T cells, so helper T cells. So we can keep track of the progression of an infection by counting these T cells in the blood. And again, the normal range is something like 1,000 per microliter, and we can survive without noticing any difference all the way down to something like 400. And what we notice is that below 400, the people will have more cases of things like athlete's foot, or more cases of the common cold, more things that often innate immunity would prevent. And then below 200, they're dealing with AIDS, where opportunistic infections become life-threatening. And then below 50, they can't fight off anything, and they don't survive very long after that. So this is what a person with untreated HIV would be facing. And again, I've already showed you this, this drawing, which is this silly cartoon drawing, but it is full of information. And it correlates the average time with the average T cell count with what sorts of infections we would see. And again, this is from Clinical Microbiology, made ridiculously simple, and this is one of the best diagrams I've seen. This explains reverse transcriptase and the way HIV works. Again, an RNA genome, it's an enveloped virus, and so it has to go through an uncoding step, and the capsid has to release the RNA. It has to make a DNA copy of that strand. It has to make a complementary DNA strand to be double-stranded. It incorporates into the genome. And then at some later time, it gets the cell to transcribe these genes and ultimately make new virions and go and spread in the body. And so that reverse transcriptase enzyme that is packaged in this virion has to be an RNA-dependent DNA polymerase. It has to make DNA from an RNA template, and then it has to make the complementary DNA from that DNA template. So it has to have both of these enzymatic activities. I've already talked about that. We do have lots of treatments for HIV. So a person in a developed country who gets HIV has a good chance of living a normal life and having a typical lifespan because we have excellent treatments. And what all of them do, or what all of them I'm aware of do, is inhibit the reverse transcriptase. So they're all called antiretroviral drugs, and they directly prevent the virus from replicating. And that's all we have. But that's good enough to prevent the progression to AIDS in most patients, and that's enough to drive the viremia so that the viruses are undetectable in the blood, and the person is no longer going to spread the virus. In people who have progressed to AIDS, we have antimicrobial therapy we can use for opportunistic infections, and we have to treat whatever they get. If they have cytomegalovirus, we have to use the scary antiherpetic drugs. And you can imagine for something like pneumocystis, we'd have to use antiprotist medications. So there are lots of different things clinicians have to know about if they're going to treat people who do have untreated HIV. And so in places where there are large populations of homeless people, a lot of people who don't have regular access to healthcare really don't have access to these treatments, and so they will get ultimately AIDS. And so in a lot of city hospitals, clinicians do have to become familiar with a lot of strange opportunistic infections that would come along with AIDS. So we have lots of ways of treating all of those things, and prevention includes both the things people had to do before the drugs existed, like condom use during sex, using clean needles for drug injection, and now we have the antiretroviral drugs. And if people are willing to take the antiretroviral drugs every day, they won't pass HIV on to anyone else. And other people who are at risk of being exposed to HIV can take antiretroviral drugs, which will prevent them from contracting HIV. So these drugs are fantastic. Why isn't there a vaccine, though? Why are people taking a daily antiretroviral to prevent getting HIV? Well, I think I've already shown you this. These are phylogenetic trees of viruses. So influenza is one of the best known viruses. And influenza evolves, even with its negative sense RNA genome, it evolves about as much worldwide in 1 year as HIV does in one person in 1 year. So you see as many mutations in all of influenza in a year as you do in one person's HIV. And if you look in one country to look at all the different mutations you could find in HIV, you find viruses that no longer resemble each other. And so HIV evolves so fast, there's just no way the immune system will ever keep up with it. That's part of the problem. So you couldn't inoculate someone with this virus and expect them to be protected against this one. It's as simple as that. One recent outbreak that I want to bring up in this lecture in particular is the HIV outbreak that happened in rural Indiana, where, well, as we know, the opioid epidemic led to a lot of people switching from prescription painkillers to heroin and injecting those. And that always leads people to risky behaviors. And so a local doctor noticed an increase in hepatitis C, which is bloodborne, and an increase in acute endocarditis. And so that acute endocarditis tends to be, or is commonly caused by intravenous drug use, because skin bacteria get into the bloodstream. And so that doctor saw the HIV epidemic coming and ended up arguing with the governor of Indiana about whether or not they could keep a needle exchange program going. And famously, they were not allowed to keep the needle exchange program going, and that may have contributed to the spread of HIV in rural Indiana. So that is a thing that happened very recently and could happen anywhere. HIV is, like I said, one of the most amazing little viruses that does unimaginable different things to a human body to avoid the immune response. There's been huge amounts of research into what HIV does, and no one really has a firm grasp on all of it, from what I understand. So these are some of the interesting things it does as a virus, but this is for your curiosity, and you can skip this if you want to. Also, as I mentioned, because of HIV, clinicians have to learn a lot more infectious diseases than they would otherwise. even like tuberculosis, which is one of the most common diseases in the world. In the US, doctors wouldn't be learning about how to treat tuberculosis, except that advanced HIV makes this more common. And I've already mentioned pneumocystis and cryptococcus, and cytomegalovirus also. That brings us to the end of part 1 of this lecture, and this was the bigger part of the lecture, and this was the diseases that affect the blood and lymph. A lot of them, as you noticed, are some of the most serious diseases, infectious diseases a person can get. So if you need to go look at pictures of teddy bears or unicorns, I recommend you do whatever it takes to wash your brain of all of this before you start studying it. And I'll see you in the next video.